Aloha, and this is Bianca at Be Fit for Health. Thank you so much, everyone, for joining me today. This is another great day for us to celebrate our health and wellness. And, today is going to be a great show. I know I say that every single week, maybe because I'm hosting the show and I know the type of guests that we are bringing on are so exceptional and so brilliant. I'm always honored to have them on my show, and today is no exception. It's a great honor for me to have this guest here today because I know particularly he's a very busy man and a wanted man on the island. And so I am lucky enough to get his time today. If you don't know who I'm talking about, let me introduce you to him. Dr. Green, our Lieutenant Governor, was elected to Hawaii State of House of Representatives, served in 2008. And he basically was also honored with an award as a Hawaii's Legislator of the Year in 2013. But he was also, as you know, he's a medical doctor. He was also awarded the Physicians of the Year in 2009. He has done a great deal of great work here in Hawaii, and he's done a great deal of great work this past year in helping us understand COVID-19 and all the information that we need. Every week he's updated us with the latest information that we need to know as to how to take care of our bodies and to protect ourselves from this virus. Dr. Green, are you on?
I am. Thanks for having me. I really appreciate it.
No, I appreciate you. Thank you so much. I know you're very busy, and I know you're doing a lot of great things for our island and for our people. So for that, I appreciate your information that you update us with every week. It's greatly needed. There's so many misconceptions out there, and there's so much information out there when you Google. People are so confused when it comes to what is it that we need to do. So when you update us every week, it helps us a lot to at least guide us in the right direction. So for that, I appreciate it.
You bet.
So I know we're short on time, so I want to get right to the point. I know we just went into a new tier system as far as the vaccination is concerned. I know we already had taken care of our kupunas in the nursing facilities and our healthcare workers. Where are we at right now when it comes to the vaccination process for the island?
Sure. So, yes, as you said, the 1A category was kupuna that live in nursing facilities in our healthcare community. And then 1B was our frontline workers and our kupuna 75 and older. We're wrapping that up very rapidly. And in about 2 weeks, on or around the 15th of March, we will move to the next category, which will be our kupuna 70 to 74.
Okay.
So if people go to hawaiicovid19.com, that's hawaiicovid19.com, they'll see updates for when you can sign up. And then about 2 weeks later, we're hoping that'll be around April 1st, we will be able to go to the 65 to 69-year-old category. So we're going to continue to be methodical about this. The good news is that this approach has been able to keep COVID contained. We only had 20 cases today statewide, lowest number that I've seen in months.
Oh, wow.
Our positivity is really low, 0.98%, lowest in the country. 41 cases on average per day the last week. So the system is working, and we're seeing fewer and fewer sick people. But that's the process. We're also now getting Johnson & Johnson vaccine, which is going to help us accelerate our process to get all of our teachers and educators vaccinated soon.
Yeah, that's incredible. So up to now, how many people have been vaccinated at this point in the island?
We've delivered 371,343 shots have been completed.
Okay.
And we're doing about 10 to 15,000 shots per day.
Mm-hmm.
So we're rapidly moving through the state. Over time, we are going to get to 900,000 plus people vaccinated.
Wow.
And it's up to people to decide whether or not they want a shot. Now, I personally believe in it. I got the shot as a healthcare provider. I got the Pfizer vaccine. People are getting the Mrna vaccine. Those are the two-shot. That's the two-shot strategies. But soon the Johnson & Johnson will be available to us. It arrives tomorrow, and that's just one shot. It provides very good immunity. So there are differences, as people have pointed out.
Right.
Johnson & Johnson protects you about 66 to 72% of the time from catching the virus, but it protects 85% of the people from severe illness, and no one has died after getting the vaccine in the first month. So it's very protective, and a lot of people will like that shot.
So you're saying that the Johnson & Johnson has less side effects than the Mrna Pfizer, or is it about the same?
The side effect profiles are almost identical. People get some achiness in their joints and in their muscles, but the side effects are the least of our concern. Really, our greatest concern is whether you get immunity or not.
Right.
And so the immunity goes up to 95% for Pfizer and Mrna, but you need two shots to get there. The Johnson & Johnson provides 66 to 72% immunity, but it does prevent any severe illness. And that's the important thing about these vaccines. So all three of them are being highly recommended by Dr. Fauci and others.
So my question then is, you know how we have designated locations to get the vaccination? Has it become statewide? Is there places like in Waianae side where people who can't make it into town or to those locations, is there going to be like a satellite area for people to go to and get these shots? Because I know some people may not be able to travel. They may not be well enough to travel. What are we doing for them?
There may very well be. There are definitely going to be more vaccines available at the pharmacies. The pharmacies are going to become the primary hubs for vaccinations, especially as we get into May and we go to the broader population. Yeah, May will be the time when all of the vaccines, especially Johnson & Johnson, which does not need to be kept at low temperature, will be easily accessible there. But there is going to continue to be some challenge. The easiest approach has been to have the two large hubs that the hospitals set up. I would not be surprised at all, though, if on the west side, perhaps Queens will set up some additional capacity over there. Right. And we did discuss having at UH West some vaccine sites. Got
it. Yeah, that would be really helpful for those people who definitely can't travel too far. So that would be great. It makes it easy of use, especially if we have a goal of hitting 900,000 by May, right? We need to get everybody easy access. So when it comes to being, I guess, notified, is our medical doctors responsible for letting people know when it's going to be ready for them, or how is this going to be facilitated to the public as to when their turn is up?
It'll mostly be through public announcements, whether it's my podcast or my social media, which is at LtGovJoshGreen. Perfect. At LtGovJoshGreen. So if people would like to sign up, also on the website, also on TV and radio all the time. Don't forget, if you're on the west side, the Waianae Comprehensive is going to be doing a lot of vaccines consistently, and they're going to be getting some of the new vaccines too. So that's one of our best hubs over on that side of the island. But it'll be everywhere, announced constantly, and so people will be able to get that. Later on, you will likely be able to get vaccines at your doctor's office once it's really into the kind of the younger, healthier population. Right. But for now, it's going to mostly be at these hospital and healthcare centers.
We really don't need to vaccinate the youth, right? I mean, you guys aren't looking at vaccinating the kids before they go to school?
They haven't been approved yet. The vaccines haven't been studied yet for younger people, so that study is ongoing, and it will probably end in the summertime. I won't be surprised if a one-shot protocol is offered to like teenagers, maybe down to age 12. But COVID-19, fortunately, has not really severely affected young people, and so I have not worried about sending my kids back to school, even though they don't have a vaccine.
Right. Do you foresee our schools opening up sooner than later? I know we're opening up, I guess, kindergarten or elementary schools. Are we looking at opening up the rest of the school? Do you have any information on that anytime soon?
Yes, we expect to salvage the fourth quarter, the education fourth quarter, which is right after spring break. Okay. So almost all elementary schools should be open at that point, and I'm hopeful that the high schools will also all open. Plus, my team's been fighting to get graduations in person with a lot of the legislation. So I think that's an important part of our culture, and so we will do that and let the process that we've gone through to keep the virus low work, and then have graduations in person. Probably with just 2 family members with each graduate, but look, it'll be better than nothing. So right? Yeah, I'm really that.
Yeah, not like last year, how we all struggled through not even having those commencement services out there. So people are very excited about what's happening now. So as far as the vaccinations, when do you think we'll hit herd immunity, when we're able to maybe not have to wear the masks or not have to worry about social distancing? Do you have a guesstimation on that?
Well, those are 2 different questions, when we hit herd immunity and when we stop wearing masks. Yes. But I think we will have herd immunity sometime this summer, maybe as early as July 4th. And at that point, we will have definitely delivered over 1.5 million shots, probably 1.6 million shots in arms by July 4th. As to when we stop wearing masks, it's likely that we will ask our communities to continue to wear masks into the fall. At this moment, my best guess would be around November 1st, when we will have really thorough statewide herd immunity and see almost no cases. It's better for us to remember that wearing masks is a good part of this process because even the best vaccinations, the best ones, are only going to deliver 95% immunity. That means 1 out of every 20 people will not be immune, and we don't want to see outbreaks. So I would like to see us get that safe before we back off. And the recommendations at first will also likely be that people don't have to wear masks outdoors when they're out in the open air. And
Right.
then after that, we'll go indoors. But we still haven't seen the end of COVID. We're just
Right.
seeing the light at the end of the tunnel right now.
So do you foresee that with the new strain that they're talking about recently from South Africa and from England, does the vaccines that we take, does that protect us from those? Or do you guys have any idea if we need to create a new vaccine for that?
It does. It's been very effective. The UK strain has not been significant here, and the South African strain, to my knowledge, has not come here.
Okay.
Now, the South African strain has been very susceptible to the Johnson & Johnson vaccine and also the Mrna. So it is working. They're going to continue to assess any kind of outbreaks and any kind of variants because in a virus that's had hundreds of millions of cases across the globe, 115 million confirmed cases, but surely another 200 million cases that were never tested for,
Right.
that's going to be a lot of variation. And we're lucky so far in Hawaii that most of the cases we've had have been the standard variant. We've seen a lot of the California variant on Maui. It's a little bit more infectious, but it is definitely containable with the vaccines. So we're doing pretty well. We're staying ahead of this wave with our vaccine process.
Right.
I would expect that when the time comes for us to begin those bigger questions about opening up, the COVID crisis will have passed, and we'll be able to open up without too much risk. But sometimes these pandemics last a long time, so I would really encourage everyone to get vaccinated if they do believe in it.
Yeah, the residuals may still linger after the effect. Do we have to keep getting vaccinated like we did with the flu? Like, is it going to be a yearly thing, or is this just a one-time shot?
Looks like it will be a booster that we'll be asked to get at least for the first year and maybe the second year. Again, we'll see where COVID goes. The numbers could drop off so significantly, and we may find that our immunity stays. Some vaccines provide immunity for a long time, like the Pneumovax. That's for pneumonia.
Right.
That's a shot that we only get 10 years, as opposed to the flu shot, which we get every year. It may very well be that the COVID vaccination booster is somewhere in the middle. But again, the research will have to go on, and this is the first full year. We've just come to the conclusion of the first full year of COVID, so we don't really know yet.
So I guess the other factor, too, is that the people that are reluctant to get the vaccination due to the fact that it was created so quickly, they're worried about some of the side effects due to maybe some of their illnesses they may have, like MS or some neurological issues. They're afraid that it might enhance it even more. What do you say to those people? How do you get them to at least understand that this vaccine is safe enough for them to take without having to worry about the long-term effect?
Well, the research that's been done has not shown that. It has not shown the exacerbation of any neurologic conditions. So I do get good updates from national experts all the time, and that has not jumped out. The only concern we have has been people who have bad allergic reactions to other shots. We've been cautioning them not to take the COVID shot unless they've got some healthcare personnel around them.
Okay.
So right now it's been fine. We have not seen any big spike of any of these illnesses or diseases. Again, people have to decide for themselves whether or not they feel comfortable. If they feel more comfortable getting the shot a little bit later, that's okay. We really want people to feel good about going through the process. But I can tell you it was good enough for me and my family. We believe in it. I got my shot. Jamie's going to get her shot when her time comes. She's in her early 40s. And, if it's offered to children, we also would very likely, in fact, we will, have our children get it because I do think it's important to stop the virus nationally.
Yeah, absolutely. You want to protect yourself as much as possible because you don't know what this virus can do. We still don't know. We're still learning about it, right? We're getting more clear with it. So I guess the other question too, with the people that don't get vaccinated on a more legislative level, like people who want to travel in and out of the state of Hawaii and want to go to the mainland or go to Europe, what are the restrictions going to be for those people who haven't been vaccinated versus the people who are vaccinated? You were talking about some kind of and I'm giving you a couple of things at the same time, I guess a travel passport. Can you explain a couple of those things to us?
Sure. So a travel passport would just be an option. And if people are vaccinated, that would be their way to be exempted against any of the quarantine rules. But people will still be able to get a pre-test if they want to travel and then avoid quarantine, just like we've been doing through the Safe Travels program. So full optional, and it's just an additional way for us to deal with travel.
Okay. Yeah, I know there's a lot of these questions, and before I, had you on, I asked a few people to give me a couple of questions that they may be concerned about, and this was one of them. Some of them aren't vaccinated, but they want to travel. Unless they're considered an essential worker, I guess there would be some slowdown on their ways of coming in and out of the state.
Yes, but the most important thing to remember is that the COVID crisis will begin to recede now, because hundreds of millions of people are going to be vaccinated. So you'll be at less risk no matter what.
Right.
We'll still rely on the same ways to stop COVID, which is social distance, being socially distanced, wearing a mask, and washing our hands. But being vaccinated means that you'll be almost immune. With a mask on, the likelihood is utterly low that you could catch it. And if you are one of those individuals that just does not believe in getting vaccinated, you still can prevent catching COVID.
Right.
You just have to be more careful.
Absolutely.
That's the main message.
Be smart. Right. So is there a way that people can view your updates, and how often do you update, and where can they go to get their updates with you?
Yes, every day, or virtually every day, I post something on Instagram and Facebook. It's at LtGovJoshGreen. That's at LtGovJoshGreen. Or join our Facebook pages, Josh Green or Lieutenant Governor Josh Green. All these are available, and I try to update some important pieces of information every day. And then on Wednesdays, we give a really big update. Usually 100,000 people or so will spread this around, and you can ask friends to give it to you too. I try to give people the raw numbers so they can judge for themselves.
Absolutely.
How we're doing.
Yeah.
And a lot of these questions get asked, and I try to give answers during the 1 or 2 minute talk that I give.
Oh, that's fantastic. And again, I really appreciate you coming on and speaking with my audience. They're very savvy when it comes to medical options and health concerns, but they, getting it from you and someone who's been in the public eye for a very long time, understanding this as a medical doctor, it's very, very reassuring to all of us. And I really, really appreciate you giving me your time and also giving us an access to continuing getting this information from you. Is there anything else that you'd like to address with the public when it comes to any misconceptions, anything that we should know as of today besides all that we have discussed?
Well, I would just thank you for putting me on the show. And look, I actually had COVID over 9/11, and it's no joy. It's very serious if you are older or if you have underlying health conditions. I was lucky. I'm pretty young and healthy, but that's not the case for everyone. And then you can, of course, spread it to your loved ones. So I strongly recommend people either be very, very diligent about mask wearing and socially distancing, and I really emphasize get the vaccine when your turn comes.
Yes,
because
absolutely.
then you're going to. But we'll continue to progress. By the end of May, we will be well over 1 million shots. Probably 1.25 million shots will be done by June 1st. We'll be tremendously safe at that point, and you'll see things begin to return to normal. But keep wearing masks and just care for one another. We're going to be okay.
Absolutely. And Lieutenant Governor Josh Green, can you please come back on my show if I call you? You've been a delight. I appreciate every information you give us.
I'm sure I'll be around, or as long as I'm serving, I'm happy to share this kind of info with you guys.
I believe you will be, sir. You're fantastic. You're a great asset to this island. Thank you so very much.
My pleasure. Take care.
You have a good day.
You too. Bye-bye.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
Okay, and we're back. We had a great interview with Lieutenant Governor Josh Green just a second ago, and we went over some of the questions that I had regarding our State of the Union as far as where we're at currently with the pandemic and the vaccines that are being rolled out. Next, I believe the next group is going to be the 70 to 75-year-olds, if I'm not mistaken, March 15th. And so I'm also very blessed and honored to have my second guest on the show, She's taking some time out from her very busy schedule because she is a wanted woman. She is a very important person in the state of Hawaii because she is Dr. Sarah Kemble. She is an infectious disease. She was an infectious disease physician of the former Epidemic Intelligence Service officer for the Center of Disease Control and Prevention. She has served as a medical director for the Communicable Disease Program and the Chicago Department of Public Health before returning to her home state in Hawaii, March 2019. She's currently serves as the acting state epidemiologist at the Hawaii State Department of Health. And let me tell you, I'm sure that's not a very easy job to do, but I appreciate you, Doctor, so much for coming on today. How are you?
I'm fine. Thank you for having me on the show today.
Well, I'm very thrilled to and actually, I'm like a little kid right now because there's so many questions that I've always had and other people have had that, this show's been on for about a year now and we've been covering it since the pandemic hit. And, we've had various types of doctors come on and talk about things that we can do to stay healthy and to avoid getting sick. But to have you on and to really give us the absolute, current state of where we're at with this virus and the vaccines and what's happening with the state of Hawaii, because, we're all here together and we want to contribute and make sure we're doing what we're supposed to do. And I appreciate you very much for coming on.
Absolutely.
So I have various amounts of questions and I hope you're able to, deal with it because there's so many, but I'm going to try to get through it as much as I can and you can do the best you can. And I know you may not have the answers for some, but that's okay. The first question is, it's been a while since anyone has explained to the audience, what the COVID-19 virus is. Can you explain to us how that affects our body once it gets into our system?
The COVID-19 virus is a respiratory virus, which means it's transmitted when people cough, sneeze, breathe hard, and that respiratory droplet gets into the air and can be inhaled by another person. It's caused by a virus called SARS-CoV-2, okay. And that's named after the original SARS virus that was known for an outbreak that started in China and was exported to some other parts of the world over 10 years ago. That was a much more severe virus in the sense of the type of illness that it caused and how sick people became. But in a way, it pales in comparison to the current pandemic because it got stopped in its tracks, and this one spread worldwide.
Yeah, it was pretty quick the way it occurred, and the transmittable factor to it is something that we weren't used to. Can you explain to me also then, with the virus being the way it is, the way it affects our body and attacks our cell, and the way it attaches to the receptor sites of the cells, and mimicking itself to be a part of our system, our body system, how did we come up with the vaccines? Do you have any idea the differences between the three vaccinations that we have currently, and explaining the technology that they've used in these vaccines and how to combat the virus itself, like the mRNA? I know that Pfizer uses the DNA. I think it's like a form of a DNA factor that helps, I guess, mimic the virus itself and catching it and releasing it, so to speak. And then also the new Johnson & Johnson vaccine that we just got.
Mm-hmm. So this is a very exciting time in science and in vaccinology because we are now applying three vaccines that are fairly new, if not novel, as far as being used in a widespread manner like this for a common disease. Two of the vaccines, the Pfizer and the Mrna vaccines, are mRNA vaccines. Okay. And RNA is basically the recipe card for our body that tells us how to make the proteins that make things work. And for the virus, it uses the mRNA to create proteins that invade our cells, and that's the spike protein. It helps to invade the human cell so the viral genetic material can integrate. Now, the vaccine teaches our body, it basically gives our body the recipe card to make that same protein that the virus would have made. It's not replicating the virus itself, just a piece of it that our body learns to detect. So when that spike protein tries to invade our cells, our body now knows how to prevent that. It can fight it off with antibodies and other aspects of our immune response that don't allow the virus in. So that's really what the mRNA vaccines are doing. The Johnson & Johnson vaccine is using an adenoviral vector. So it's taking another common respiratory virus, the adenovirus that causes the common cold. It's taking a non-pathogenic form of that and incorporating that same recipe card type of concept into that other virus's shell, basically. So it can present that to the body, the human body, and from that we can learn the same thing, how to recognize that and fight it off.
So how does that, what happens after the mRNA does its job? Does it disappear, or how does that work? It doesn't go into our cell, right? It just it lingers outside of the cell, right?
Exactly. So our body uses RNA all the time, and it gets presented RNA from other viruses all the time. mRNA, because it's just the recipe card, it gets read, the protein gets created, and then it kind of gets ripped up and tossed out. So the vaccine is presenting that information to us, and once we have the information we need, it degrades, it basically just dissolves or disintegrates, and so it doesn't stick around in the body. So it's not like it's changing our genetic material or integrating with our DNA or anything like that. It's just getting read so that we can produce the proteins we need to have that immune response.
Well, what's really interesting to me is that because we know that we have a particular virus brand, let's just say COVID-19 is a brand, right? So we were able to utilize this technology. But prior to that, the flu shots, we were guesstimating which viruses were going to be potent for that year. So we really couldn't create an mRNA for those flu shots, correct? Because we would have to figure out which virus it was in order for us to give the right message to the body to do what it's supposed to do.
This is a pretty new way of developing a vaccine. So it's been tried in scientific laboratories and research studies, but it's not been applied on a wide scale in the human population like this before. So who knows what we can do with this technology now that we've done the proof of concept. Maybe we will be able to develop other vaccines that use the same principles and can be developed more quickly or more effectively. One issue with the flu vaccine is it's had to be created in eggs, and it takes a long time to grow the virus in eggs. And it's always a race every year to identify which strains are going to be the predominant ones and then get that vaccine cooked up in time to be ready for the next flu season. The mRNA technology, at least what we're hearing from some of the manufacturers, is that can be pivoted more quickly. So perhaps in future, even if COVID did mutate enough that we needed to change the vaccine, it's possible to manufacture a vaccine that meets that new need, and it doesn't have quite as long a development timeline.
Yeah, I was going to say, this is a really rarity that we were able to turn over a vaccine in 10 months versus something that would take years and years. Is it also because of the funding that was created to produce this vaccine that made it so quick? Because I know in the past we would have to get funding for creating certain types of vaccines in the past.
Yeah, given that this was a new technology, I think the funding that the federal government put into development was critical. It really helped jumpstart a lot of the pieces that are needed to coordinate and bring together the research in order to develop a new vaccine like this. So
would you say that you guys wouldn't be able to guesstimate the long-term effects of this vaccine? Yeah, because this isn't something that we've ventured into before. Because a lot of people a few people, small percentage, are worried about taking the vaccine because they don't understand the technology in which this was created, and they don't know what's going to happen if the vaccine itself changes or alters any type of their natural ability to fight off any type of bacteriums or virus in itself. They're just worried that it might cause other types of problems in their bodies, let's just say. So I would like you to put that to rest if you can. Can you give us any type of understanding of how safe this is for the human body to be in the long term, possibly, like a year from now?
Sure. These vaccines appear to be incredibly safe. They are, as I said, they're not actually changing anything in our genetics, or there's nothing in the vaccine that should have a longer-term impact on the body. The concerns that have been raised that we see with any new vaccine are things like allergic reactions. And so understanding what might cause those allergic reactions and making sure people who have those allergies are steered towards a different version of the vaccine is going to be important. But overall, the safety data for all three vaccines is really good. They're very well tolerated, and they don't have many adverse reactions.
I was going to say, is there any drug interaction contraindications when it comes to taking medications of sort with this vaccine? Would there be any stalling of, obviously you can't take this medication with this medication because then it becomes less potent. Is there anything that we would worry about with that?
Nothing with the kinds of medications that you would typically take by mouth. The one precaution is with other vaccines, and so that's mainly because of there's not enough scientific knowledge yet to know if vaccines might reduce. If you take two vaccines together, would one potentially be less immunogenic than the other? And that can sometimes happen when you have vaccines that are given too close together. So the one precaution is if you're going to get the COVID vaccine, try to avoid having it within 14 days of another vaccine, such as flu or other vaccines like that. And that's a theoretical concern, but and so if you happen to get both within 14 days, it doesn't mean you have to go back and do it again. But that's the one precaution that's out there.
So,
as far as other meds that people take for other, blood pressure, other medications, nothing like that that's been an interaction with the vaccine.
That's great to hear, because I know that was a concern for some people too who are on a lot of medication. They're like, how's that going to affect my, if I'm diabetic, some of my insulin that I take in, because some things are injectable, right? Some things they do may not be by mouth. So they were kind of concerned with that.
Right. No concerns there.
Oh, yeah. That's wonderful news. The second part of it too is that we need a second shot. So why do we have to take two shots for the Mrna and the Pfizer versus the Johnson & Johnson being only one?
So the two mRNA vaccines were tested with the concept of having a first dose and a booster. So the emergency use authorizations that they have received are for that two-dose series. There are studies being done now to also look at efficacy of one dose. But at this time, what's proven is the two-dose series for those two mRNA vaccines. Johnson & Johnson is a new vaccine that only requires one shot. So that got tested as a single dose and is also showing great efficacy and safety.
So does that mean that the Johnson & Johnson injection is more potent, or does it just have does it have more of a half-life or less of a half-life? How does that work?
It means that, as it was evaluated in the trial, in terms of preventing symptomatic SARS-CoV-2 infection, and especially important in terms of preventing hospitalization and death, it had really good efficacy. Each vaccine is evaluated for those endpoints, and they're hard to compare to each other exactly because each one is designed as a different regimen. But the good news is they all have good efficacy data. They all prevent the outcomes that are really critical for us to prevent. And the more doses we get as a population, the closer we get to herd immunity.
So I was going to say too, if someone had COVID-19 before, like our lieutenant governor who had it, and you have the antibodies, your body recognizes the fact that the virus was in it and had to create an immunity response. Do we have to take the vaccine then, because you already have what we're trying to create with the vaccines, which is to create antibodies, right? Do those people need to take the vaccine?
Yeah, that's a great question. So even though we do know people who had the virus already have some protection from their own natural immunity against getting reinfected, we do sometimes see reinfection. The vaccines that are out on the market now have not yet been studied enough to say whether they're better than natural immunity or not, but there are some theories that they might be. Part of the reason is the kind of immune response they generate. They are generating a really robust immune response to that spike protein. Mm-hmm. Our body is seeing different aspects of the virus when we get natural infection and may produce a certain level of antibody to those different parts of the virus that it sees. These are creating an even stronger or more potent immune response to certain aspects of the virus, and that could potentially have a generate a longer-lasting immune response for us. For that reason, we are recommending that people, even if they've been infected before and they were positive before, that they still go and get one of these vaccines. Okay,
so I guess that's something that most people were like. That was one of the bigger questions that I got from a lot of my viewers, is that, I already had it, my uncle had it, I don't want them to get the vaccine and maybe get sick again because of the side effects. And so they were concerned about all of that stuff. So it's reassuring to know that you're advocating that even if you did have it and your immune system is been familiar with it, it's good to kind of back it up with another dose.
It's an extra big boost to make sure you don't get it again. So even if you've had COVID before, we recommend going to get the vaccine.
So how long do these vaccines last in the body? Because like with the flu shot, we get it every year. Do we have to now do this every single year?
We don't know yet. So that's something that we continue to watch the data as we get months out from the early trials. Those people are still being followed to see how long that immunity lasts. That's going to be really important data for us to know, is this going to be a one and done, or is this going to be a shot that we're going to need to get periodic boosters for?
Yeah, that's
Yep.
Yay.
I think we'd all like to know that, but
yeah, I know
the jury's still out.
So how are we doing research on these? I mean, who's doing the research on this, and how are we coming up with? I mean, the answers are coming to us fairly quickly. I'm assuming, because there's a lot of research being done as we speak. But how quickly do you think we'll know? By the end of this year, exactly where we're going to stand with this virus? I mean, how long do you see this going on for, especially in the state of Hawaii, that once we get everybody vaccinated, do you foresee us having to still deal with what we're dealing with today, which is still wearing the masks and doing the social distancing? Because there is a new variant out there, the L452R, that we're keeping an eye on. Is that something that we should be concerned about as well? And is that going to keep us still kind of, so to speak, locked up in our masks and our social distancing factor?
I do think the new variants are one of the reasons we're going to still need to be practicing good masking and physical distancing for some months to come. Each month that passes, we learn more about what the impact of the vaccines is and how well they're doing against the variants. The Johnson & Johnson vaccine that's out now, one of the countries it was tested in was in South Africa. Now, the efficacy of the vaccine in terms of how many symptomatic infections it prevented was a little bit lower in South Africa than some of the other countries studied. They have a variant circulating there that was 95% of their enrollees in the trial that is looking to be a little bit harder to stop with the vaccine. That being said, there were no deaths in the vaccine arm, and there were deaths in the placebo arm. Hospitalizations were also greatly reduced, even in South Africa. So the really important things that we want out of a vaccine, which are to prevent those severe outcomes,
right,
we're still seeing even in the face of that variant. I think that's encouraging news,
right.
And I think it just goes to show why getting the vaccination out there is, number one right now, because we can get to a point where we stop having people showing up in our hospitals or having severe illness that might result in death. And that's the most important part of this vaccination campaign.
What is this variant anyway? Because, what's the, structural integrity of this virus versus what we had been used to for the year? What makes it so much more compelling for us to kind of slow things down and go, this may not be a good bug for us to deal with?
There are a number of different variants because the virus is always mutating.
Right.
In a way, the more people that we vaccinate, that slows down the virus in general. It has less chance to mutate and less concern that some new mutation that really evades vaccine or does something terrible gets out there. So as we move through as a nation, getting people vaccinated, that's one of the objectives, is to stay ahead of that curve so we don't end up in a situation where we give that virus the opportunity to mutate more. Now, the variants that have been of concern, the reasons for concern are a couple different ones. One might be, for instance, the UK variant, the B.1.1.7, seems to transmit more easily than other strains. So if you have a variant that's transmitting more easily, you might have to vaccinate more people to get to herd immunity, which is that tipping point where you have enough people vaccinated that the virus just can't kind of keep self-perpetuating and it will slowly die out. The other concern with a variant such as P1 in Brazil are that it has a mutation in it that requires you to generate more antibodies to overcome that version of the virus. And those are the ones where we worry that maybe vaccine is not going to be quite as effective. Now, I'm encouraged to see that the early data are still showing, even if it doesn't prevent symptomatic infection, it's still preventing hospitalization and death.
Are we sure?
Those are some of the...
I was going to say, are we sure that this is coming from the same virus, though? Because it seems like different regions are giving us different types of variants from what I'm hearing. I mean, are we sure that this is coming from the COVID coronavirus? Is the mutation coming from that?
Yes, we are, because we're now able to, with the technologies that we have today, we're able to run the whole genome of the virus and sequence it and know quite well what its ancestry is. And so we've been able to follow the ancestry and the different lineages of the virus of SARS-CoV-2 around the world. And this is a natural phenomenon. You've heard about the Galapagos, where birds ended up there blown from some other continent. And because they were isolated together for a long period of time, you have a unique species that develops. Well, with viruses, it's similar. You have different parts of the world, different locations, and a virus that's circulating in one area will mutate naturally over time and will look a little different than its cousin that mutated on a different continent or in a different area. And so that process of a little bit of drift is natural, but these are all still SARS-CoV-2 at this point.
And can be treatable
and
the
it's
same.
Actually been treated with the same vaccines, the same medications.
Interesting. Yeah, that's kind of cool because, I mean, as I was reading through this and trying to do some homework prior to talking to you, so I sound intelligent, I was like, oh, there's like all these different variants, but then are we sure that this is coming from the same, thing that we're dealing with? Because different regions, different types of viruses, different types of bacteriums because of the environment and situation. So I thought, wow, maybe I'm curious to see how they're coming up with this. And if the vaccines that we're taking now are going to be able to protect us with those mutated variants.
Yeah, well, the amazing thing now is we can have so much genetic knowledge of a virus like this that we can actually really parse out how, even to some degree, how it's spreading or what other lineages it might be related to. And that's the same kind of technology that the vaccine developers can use to design new vaccines that keep pace if the virus does mutate. That's
crazy. I'm somewhat of a naturalist because I'm a fitness health fanatic for 30 plus years. So, I've always tried to do things with nutritional and supplemental when it comes to certain things because our soils aren't as abundant with minerals and things like that. What do you think of those people who are healthy, don't have other secondary issues, who want to just basically keep their immune system up by doing like sleeping and taking vitamin D and zinc and things like that? I mean, how would you advise them? Because you're in the trenches of this and you understand it better than most.
Right. There are a lot of great, vitamins and practices that can help boost the immune system. But when it comes to fighting off a specific virus like the SARS-CoV-2 virus, it really does take something like a vaccine to teach your body. You really need that recipe card in order to be able to recognize the invader, so to speak. And that's what vaccines do. So that's a technology now that allows us to keep ourselves healthier, and in this case, keep our whole communities healthier. I think one of the biggest reasons to take the vaccine for those who are, wondering if they should is to remember it's not just to protect you yourself. It also means that if you can't get it and you can't infect others around you, you're not spreading it, and we're slowing down the virus in our community overall.
Right. I mean, I might get it, but I may not have symptoms because I'm healthy. But then if it's one of those things where it likes to sharing is caring with this virus's motto. You're preventing that from carrying through. So the other question I had was, with these vaccines, I always had this thought throughout the years is if I have a 300-pound guy who's all muscle, and then I had like a 120-pound female who's got some fat and some muscle, how does these vaccines work? I mean, it's because, if you're giving the same amount of dosage to each person, there are different sizes and different genetics and different sexes. How does that work?
Well, remember that this works a little bit differently than a medicine you take by mouth. where you might have to adjust the dose for your size. With a vaccine, we're kind of mimicking the process of the pathogen itself, the virus itself. So it's not like a bigger person needs a bigger sneeze to get infected with COVID in the first place.
Right.
So you're just presenting the dose that's needed for your body to pay attention. And once it recognizes that foreign invader, it starts mounting its immune response. And that the body itself is generating the size of the dose you need to prevent the actual virus from getting in. So it's actually your body's response that's protecting you.
Correct.
And the vaccine itself is just like, hello, hi there, it's me. And your body recognizes that.
It's so friendly.
Yeah.
We're animating the virus now.
Yeah.
So yeah. I would say too, the other question that I had was, if you got the vaccine, is there still a chance of you getting sick? Could you still get the virus? I mean, you're protecting yourself, but then sometimes, you get the flu shot and let's say some months have gone by, but then you get the flu. I mean, it can happen, right?
Right. So, efficacy, when we talk about vaccine efficacy, we're basically counting how many people who got the vaccine in the trial ended up developing symptoms and then testing positive for COVID. And then you're looking at the other arm, which is the placebo arm, and counting the same thing. So how many people who got a shot that was actually a placebo ended up developing symptoms and testing positive. And so when we see an efficacy rate of like 95%, that means that the people in the vaccine arm, compared to those in the placebo arm, had 95% less chance of developing symptomatic infection.
Right.
That means there's still 5% that did, right? So
right.
Nothing is a complete magic bullet.
Right.
There's going to be a few breakthrough cases, but that's a pretty good efficacy rate. And what's even more impressive is that so far in the 3 vaccine trials for these 3 vaccines, there have been no deaths reported in the arms that received the vaccine. And so that means that even though some people, yes, may still get symptomatic disease, that hospitalization and the death outcomes are being really well prevented. And that's pretty impressive.
Yeah, that's pretty high numbers considering this is the first vaccine that we've produced for something like this in a short amount of time. I mean, that's pretty incredible for those people who created the vaccine to be so on point for something that's been created so quickly.
Yeah.
So is there anything that you can tell our audience? I mean, because as far as the state of our state when it comes to where we're going to be by, let's say, June, if we are able to immunize everybody that we'd like to immunize, and schools opening up, possibly. I mean, I don't know. I'm sure the governor spends a lot of time with you guys to get the updated science, but where do you see our state being at once we get that herd immunity, or if we have enough people vaccinated? Do you see us going back to somewhat normal to what we were before last year?
The idea is that once we reach herd immunity, whatever that level is, that we would be able to return to what we remember as normal for the most part.
Yeah.
I think there's still some unanswered questions, and if there's one thing this virus has taught us, it's to be humble. There's a lot that we have learned in the last year that we didn't know about it in the beginning, and it continues to teach us new lessons. So I think that we have to sort of take it month by month right now, but certainly with a good dose of hope right now that as we continue to vaccinate, we'll be able to reach that point where the virus is just not circulating at this level anymore, and people can go back to living without masks. Until we get there, though, it's still really critical in the next few months to keep wearing your mask and to keep your distance from others, because we want to make sure that all people who are at risk of those severe outcomes get their shots if they wanted to get them, and that we're protected as a community before we get to that point of relaxing.
Yeah, I think a lot of people are also concerned about travel, and with our state being a touristic economy, we want to be able to bring people back into our state. And how safe do you feel with that? Like, what's your concerns about that? Because I know that's going to be something that we want to open up sooner than later, but we want to do it in a way that's safe, but not detrimental to our economy that's been hit for the past year.
Right. I mean, one thing that we have to remember right now, unfortunately, is that even though we're making great progress with the vaccine, we're still looking at about 15% of our state's population being vaccinated. So there's still a lot of people who are susceptible out there. And so travel is always a risk because we've done remarkably well here in Hawaii in terms of keeping case numbers low, knock on wood. But there are a lot of jurisdictions that are still seeing pretty high case rates. So when we have travelers come in, there's always that possibility of introducing the virus or new variants of virus, which may behave differently than the older ones. So caution still required around travel. Department of Health still recommends if you're able to get tested 3 to 5 days after you return from your travel, it's highly recommended, and to try to avoid close contact with others while you're waiting for that test result.
Yeah, absolutely. And it's much appreciated. Thank you so much, Dr. Kemble, for coming on today. I don't want to keep you longer than I promised, but I want to say thank you for giving us this information. And I'd like to reach out to you if I can at some point, if you have the time to come back on the show and update us again with where we are and what we've learned, because I think this is the education factor is so imperative for making decisions, right? You can't make a good decision if you don't have the information. And I think what you've just done today was really important, giving us some reassurance about the vaccine, making us understand, exactly what it is and how it's administered and what the effects are. So for that, I appreciate you. And I look forward to possibly speaking with you again in the near future.
Well, thank you for having me on the show.
Absolutely. Take care of yourself and aloha.
Aloha. Bye.
Aloha. Bye-bye. All right, guys. Well, that was a fantastic hour. I can't say that, I've learned more than I thought I would. And I'm very honored and I feel privileged to have interviewed such exceptional guests. And I hope you guys learned something too. And if you guys have any questions, go ahead and reach out to me. I'd be more than happy to direct you to the right people. I'd be more than happy to direct you to some of the information that I received. But it is important to be educated before you do anything and make any decisions in your life, right? That's the way it should always be. But other than that, it's a beautiful day. Please make sure you take yourself outside, get some vitamin D. We think that's important, right? And enjoy your rest of your day and your family. Take care of yourselves and each other. I wish you all the best. Aloha.